Hello guys, my name is Nightwolf, and welcome back to some more surgery games. Okay, so this time, we are doing a tonsillectomy, a LASIK eye surgery, a laser hair removal, and a lumpectomy, which I don't know what the lumpectomy is. But, let's go ahead and start.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr. Jeff.
Yay.
Today we'll be removing a young man's tonsils. This is a common operation that's performed when a patient suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle. Tonsils are infection fighters, but occasionally they lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under. Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
So, I've never had a tonsillectomy done, but my brother has, and apparently it sucks.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth, depresses the tongue, and locks into position. Why don't you take a crack at that? Great job. That should give us plenty of room. Now we have to reach in and grab the infected tonsil with the tonsil forceps. We need to pull it to the side to expose the connective tissue. Can you do that for me?
Yeah, there we go.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current to cut away tissue and seal off the blood vessels at the same time.
Okay.
By removing the tonsils this way, we reduce bleeding and allow the patient to heal faster. Now that the tonsil has been cauterized, we reach in with a tonsil guillotine clamp. The clamp severs the last of the connective tissue and allows us to remove the tonsil from the throat. Clamp the tonsil and pull it out. We'll bring the electrocautery device back in here and apply it to any bleeding areas. Because this part of the throat heals quickly, we won't need any stitches.
Okay.
Now we repeat our steps on the other side of the throat. Extend the other tonsil with the tonsil forceps. Just like the other side, we'll cauterize this tonsil to
Cool.
And finally, we need to remove the tonsil.
Do the tonsil lasso.
And don't forget those bleeders.
Yes.
I'll clean out the mouth with some irrigation and suction, and then we're all done. We'll send our patient to recovery for 8 to 10 hours, and more than likely he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry? Thanks for stopping by SurgerySquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
So we have a childbirth epidural and a virtual LASIK eye surgery. Luckily, I was already planning on doing the LASIK eye surgery, so that's what we're going to be doing. LASIK eye surgery. Yeah. Okay.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses.
Okay.
LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so
Makes
we'll
sense.
use drops to numb the eye. Can you place a few drops into her eyes?
Yes, I can. Boom. Boom. Yeah.
Even with the numbing
Good.
drops, it's possible that the patient can feel pressure and mild discomfort, but they
Ooh.
do help with most or all the pain.
Okay.
Debris can complicate the procedure, so we need to
Yeah.
make sure that the area around the eye is clean.
Wax
Now
on.
that the area
Wax
around
on.
the eye is clean, we'll use a device called a
Wax on.
speculum to hold the
Wax.
eyelid open wide. So let's
Oh.
get that speculum
Cocker
over
going
the
again.
eye. If the patient was allowed to blink, we might cut or burn the wrong area.
Yeah.
At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction
flap.
ring over the eye.
Oh. Hello. It's like I'm zooming in on her eye.
The ring sucks the cornea upward,
Oh.
making it easier to cut. The patient's
cut the
vision
eyeball.
will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
It's like all gelatinous.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea. This is the part we'll reshape with a laser.
Okay.
The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the
Surgey
switch to fire up the
squad
laser, and the
4500.
reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60
You mean
seconds.
cut it?
The laser makes a slight clicking sound, and you might notice a faint smell similar of burning hair.
Ew.
And that's it. Please fold the corneal flap back into
Really?
the original position. Nicely done. While you were working, I went ahead and took care of the other eye.
Great.
We will observe our patient for several minutes to assure the corneas
This
bond
happened to my eye
correctly.
now.
The cornea is quite
Ah.
amazing in this respect. It will be bonded back to each eye in moments. Even with the
Really?
corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye.
Hey.
This keeps the patient from bumping or
Shield's
rubbing
cool.
her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home, as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on SurgerySquad.com.
So we have virtual teeth whitening and the virtual colonoscopy. Let's not do any of those. Let's go with a laser hair removal one. And then there's one more after this one. And then we'll be done. These are going faster than last time. Which I don't know why. Are they just easier? Are they shorter? I didn't mean for them to be shorter.
Welcome to Surgery Squad's virtual laser hair removal. I'm Dr. Jeff, and I'll be assisting you with this surgery
Back to
today.
Dr. Jeff.
Everyone gets hair where they really don't care to have it. Fortunately for all of us, we have the option of laser hair removal. Laser hair removal is a non-invasive cosmetic procedure that uses a laser to remove unwanted hair. The energy from the laser damages the hair follicle, which reduces the hair's ability to grow. Although laser hair removal is an incredibly popular procedure, not everyone is a good candidate. The best candidates are those who have hair that is darker than their skin. Individuals who have a darker complexion or lighter colored hair may have their skin inadvertently damaged by the laser. These individuals may also need more treatments to get rid of the unwanted hair. Our patient today is a male in his 30s that wants to get rid of some unsightly back hair. As you can see, he is an ideal candidate since his hair is darker than his skin. I've already given our patient special goggles to protect his eyes from the intense light that is emitted from the laser. To get things started, we first need to shave the treatment area.
Shave it? Yeah, every little thing. Sorry, dog, I'm OCD. Can't miss a spot. Almost done. Need to get that, need to get that. Oh, need to get that, and that, and that, and that, and that, and that, and then there you go. So that's something I'm going to create. Okay. Now we're done. Continue. Okay, you know what? Okay, so it's done. Again, really? Okay. You know what? I'm gonna... Okay, so that is done. I missed a spot. Okay, now we shave it. I'm just gonna continue. Yes. That's not how shaving looks. You don't... You know what? Done. Sure. Boom, boom. I don't know why it's lagging so much.
Great.
Okay, so it should be better now. Yes, done. This area now. Done. And this area now. Done.
Now that the topical anesthetic is applied, we'll need to wait about 30 minutes or so for it to take effect. The anesthetic has set in. It's time to zap some follicles.
Okay.
The most important step of laser hair removal is to get rid of the unwanted hair using our laser. As you guide the laser over the treatment area, it shoots tiny bursts of energy which travels through the skin and is absorbed by the hair follicles. By doing this, we're damaging the hair follicle and reducing any future growth. Why don't you try it out?
Am I scanning something at like a grocery store? It looks like you got sunburned. Look at the difference. Red, not red. Red, not red. Why does it look like you got sunburnt? Oh, I pressed continue on accident. Okay, done.
Perfect. Are you sure you haven't done this before?
Yes.
After the procedure has been completed, our patient's skin may appear red or irritated. Luckily, this lasts only a day or so. It's extremely important to avoid the sun or use sunblock for a few weeks after the procedure, and avoid any plucking or waxing of the treatment area. Immediately after the treatment, our patient can apply cold compresses to the area to help alleviate any discomfort. Within a few weeks after the procedure, he may notice some new hair growth from the treated hair follicles that were inactive at the time. Because of this, our patient may need to undergo multiple treatments. Most individuals receive a total of 6 to 8 treatments before achieving desired results. The overall results of each treatment rely greatly on an individual's skin tone, hair type, and growth phase of the hair within the treatment area. Laser hair removal may not prevent hair from growing completely, but after multiple treatments, it can significantly reduce the amount of unwanted growth. And that's laser hair removal.
Okay.
I couldn't have done it better myself. Why not try your skills in another surgery here on SurgerySquad.com.
Teeth cleaning and a teeth whitening. I'm not going to do either of those. Instead, we're going to do a lumpectomy, which I don't know what it is. It's something having to do with cancer, I know that much.
Welcome to Surgery Squad's virtual lumpectomy. I'm Dr. Susie, and I'll be assisting you with this procedure today. Breast cancer is a type of cancer that originates in the inner lining of the breast's milk ducts. And with the exception of skin cancer, it's the most common type of cancer in the United States. While we don't know what causes breast cancer, we do know that certain risk factors, such as age, genetics, personal health history, and diet, put people at a higher risk of developing the disease. Fortunately for our patient today, and the 200,000 women and men that are diagnosed with breast cancer each year, there are a number of treatment options available. This includes surgery, chemotherapy, radiation, hormonal treatments, and holistic medicine. Recently, our patient was diagnosed with stage 1 breast cancer after her doctor discovered a 2-centimeter tumor, or lump, within her right breast. Her doctor also determined that it is not spread into the lymph nodes in her underarms. If it had, we would need to reevaluate her treatment and breast cancer stage. One of the steps that we'll take today to eliminate our patient's breast cancer is a surgical procedure known as a lumpectomy. A lumpectomy is a brief, breast-preserving surgery that is used to remove a tumor from the breast. During the operation, 2 to 5 millimeters of the healthy tissue surrounding the tumor will also be removed for precautionary purposes. As with any surgery, there are some risks involved. For a lumpectomy, the common risks are a loss of sensation in the treated breasts, and breasts that don't match in size and shape after the surgery.
Makes sense.
If you're up for the challenge, let's put on our gloves and see what we can do. To begin the surgery, we need to start an IV to provide our patient with fluids and medication. I've already tied a tourniquet around her upper arm. Can you find a suitable vein in the patient's hand?
That one's suitable.
That'll work. Sterilize the insertion area using an alcohol wipe. Insert the needle and advance the angiocatheter into the vein.
Angiocatheter. Yes. Real medical.
The small burst of blood that just appeared in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
Okay.
Once you remove the needle, it will be properly disposed into a sharps container. I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. Lastly, we need to secure the IV with tape and test the line.
Test the line? Oh, I'm having to do all of it, okay. This is new.
For those with a weak stomach or have children in the room, I need to let you know that the next few steps get a bit graphic and contain nudity.
Okay.
This procedure may not be appropriate for work or school environments.
So, I'm gonna pause
Click the continue button when ready.
I'm gonna pause it. Right now. I'm gonna cut this. Well, yeah, I'm gonna pause the recording and then do it and then resume the recording right after. Because I don't want to get any strikes for inappropriate stuff. So, I'll be back here shortly.
Once it's in place, we'll turn on the anesthetic gas.
Okay. I have my hand on the pause button.
Now that our patient is unconscious, we'll insert an endotracheal tube into her mouth and down into the windpipe. This will help her breathe and provide a constant mixture of oxygen and anesthetic gases during surgery.
Okay.
The side of her right
Actually,
breast
fuck that.
and
I
about
don't
2 centimeters
care.
from the surface.
Okay.
I think the best procedure to use in this case is
This
what
is
is known as a
the
batwing
before children
mastopexy.
anyway.
Use the pin to outline the location of the tumor.
Outline it. There we go.
Now sketch
Okay.
where we'll
Well, I
be
have to
making
follow.
our incisions.
Okay. So let's do this correctly. Yeah, I don't care if this gets demonetized or whatever because of nudity.
Perfect, but we're far from done.
Yeah.
Grab your scalpel and make the necessary incisions. This will allow us access into the breast to remove the tumor.
Okay. Oh. Yeah, we did it.
Now remove the tumor and tissue from the breast using forceps.
Yeah.
Great. I'll send this to our pathology lab for examination. In the meantime, why don't you go ahead and close the incision?
It's tighter. It's uplifted. Hey,
Before we finish closing the incision, we need to irrigate the wound using a bulb drain. Drag the stylet and tubing through the incision to create a small puncture hole near the bottom of the breast.
Oh.
Great work! This tube will allow fluids to drain properly and aid in the healing process. Now we can finish closing the incision.
Want a boob lift? Well, get one of these. You get a partial one just by having one. Yeah. Well,
Excellent work! After the surgery, our patient will be moved to a recovery room within the hospital, where her heart rate, temperature, and blood pressure will be monitored by our wonderful healthcare team for the next few hours. Typically, a patient doesn't have to stay overnight unless they're having their lymph nodes removed in addition to the lumpectomy.
1600 BC.
When our patient returns home, she needs to ensure that she is following her doctor's recovery guidelines. These guidelines will include getting adequate rest,
Okay.
taking pain medication as directed, taking sponge baths until her sutures are removed, investing in a good sports bra that will help minimize any movement that may cause pain. After a lumpectomy, most patients will need to undergo 5 to 7 weeks of radiation therapy to ensure that the cancer is gone. The radiation therapy may also affect the patient's options for breast reconstruction. And that's a lumpectomy. I hope you've enjoyed playing and you've learned a bit about breast cancer and the lumpectomy procedure.
Well,
If you're up to it, check out another procedure on surgerysquad.com.
we have a liposuction surgery. Well, tumescent liposuction surgery and natural childbirth. But I am going to have to end this video here, and there will be an age rating, just so I don't get any hate comments from people saying that I shouldn't have nudity in my videos. But it was ritual, and it was for science, for medical reasons. So yeah, I will be ending this video right here. Make sure you like and subscribe, and have a good weekend.